The suspension trauma is supposed to be also dangerous and can lead to death within a few minutes. It has been supposed in the 1970s that this is due to a pooling of the venous blood in the lower legs only, and therefore they said that time that if you rescue a person hanging in a rope motionless, you should not put him in a supine position immediately, but let him in a sitting position for half an hour, more or less. Our question was, is this still true? Is the pathophysiology different from a pooling? Are there other factors? Because we suspected that it can also be a neural factor that leads to an immediate loss of consciousness. And therefore we choose volunteers who were able to hang in a rope freely, motionless, for up to 1 hour. And we have seen that in 30% they collapsed in a time between 15 and 45 minutes. And we observed the pooling of venous blood in the lower legs, but this was immediately in the first 5 minutes when they started hanging, and then it did not go farther on. It did not increase during the hanging period, but all of them collapsed immediately, suddenly, without any clinical signs before. So this is really somewhat very worrisome. That means that rescue teams, if they have a hanging person motionless in a rope, they should not take it easy. Even if they are fully responsive, they do not know when the person will collapse. And there are no signs that precede the collapse. And between the collapse and the cardiac arrest, there might be only a few minutes. So the sitting position we can forget. A person with a suspension trauma has to be laid in a supine position and treated like another patient.